We've had a couple of questions come in over the chat room, Sandeep, so I thought I would put two of those to you if you don't mind. I know you've just been talking quite a bit. But the first question is a pretty straightforward one about the DTS and NDTS, if that's publicly accessible. So is the DTS and NDTS publicly accessible? And the second question, and that question was from Katerina Hamed. The second question is from Michael Tarsila, who is an evaluation consultant working for UNICEF in West Africa. And Michael has asked, in response to your first slide, I have a question on capacity measurement. What tools do you use to measure the operational capacity of humanitarian actors, such as international NGOs, that might be interested in contributing to the humanitarian response, but do not yet have any presence or staff in the country or in the affected areas? So that's a question. You mentioned, Sandeep, a few times about operational capacity, that the 3 Ws don't assess this, that you have the CHF partner capacity assessments, and then the specific cash capacity assessments. Beyond those that you've already discussed, are there other capacity measurement tools that you can use to measure the operational capacity of new humanitarian actors, new international NGOs that are not currently part of the response but want to become part of that response? And then the first question on DTS and NDTS and it's being publicly accessible. So if you could answer those two questions, Sandeep, we'd be most grateful.
Yes, the DTS and NDTS are both publicly accessible. The data is in the Humanitarian Data Exchange platform, and there are interactive dashboards both in the Humanitarian Exchange platform and the Humanitarian Response website for Afghanistan. For your second question, like when I talked about operational capacity, it's not really a capacity assessment. So it does not really, although the name suggests capacity, but it's not really a capacity. It's just a potential. It's just a potential capacity of organizations that may be able to provide humanitarian assistance, but who are not currently doing so. Other than the CHF and the recent CAS-based programming, we currently have any other capacity assessment programs. Even though, like for new NGOs, even though they are not working in Afghanistan, they could certainly always be a partner of other agencies that are working. There's no restriction that the agency has to be previously working in Afghanistan to apply for these capacity assessment for the CHF. Does that answer your question? Like they can have a track record in other countries?
I think that gets to the question, Sandeep, and I think if Mikhail has any follow-up, they can feel free to contact us and we can follow up after the webinar. But I think that that's a really good overview response to that question. We also had a question of clarification for Abby coming in from Claire Barnhorn, who's wondering about how you did the counting, Abby, in this research. So how were different MSF entities such as MSF Holland, MSF Germany, and MSF OCB counted towards the NGO count? You know, were they included in that NGO count or were they counted somehow separately? So Abby, just a quick clarification on that.
Yeah, just quickly, it depends on how they, on their own model and how they identified in the field, whether as separate organizations with different management structures and staffs. If so, we counted them accordingly. For the kind of cross-country global index, where we looked at the most and least present, we would combine the federated organizations into one, and that would default to the most present affiliate.
Great, thanks so much. And speaking of MSF, I'd like to pose a question to both of our speakers that was sent in to us by MSF Spain. So Abby mentioned that MSF produced their Where is Everyone report in 2014 around this issue of presence. And MSF over the past year has now been producing a new series of reports on presence and coverage called the Emergency Gap Project, and there will be a link to that coming through your chat box. The Emergency Gap Project identifies the enablers and disablers for effective emergency response in armed conflicts, really based on the perspectives of MSF's operations and field practice. Their most recent report reflects on the role of insecurity as a factor in reducing operational presence, so very relevant to this discussion today. And based on this work, MSF would like to pose the following question to Abby and Sandeep. The question is, how do you think humanitarian donors and actors need to be changing their perceptions and attitudes around risk in order to improve presence? So Sandeep, you mentioned issues around risk and data sharing, and Abby, I think that was a theme in your presentation as well. How do these perceptions of risk affect agencies' decisions about where they go and where they operate? Do data and evidence play a role in changing these mental models and bringing about a mind shift, or do you think it's more based around the practical commitment of the humanitarian principles? So, for example, Abby, you had your red map, and Sandeep, you also had the map on your fantastic dashboard showing the gaps in presence and coverage. When humanitarian actors are faced with those maps, does that compel them to act differently, or do you think that this is going to be driven more around practical commitments to humanitarian principles? So we'll look to you, Abby, first to respond, and then followed by Sandeep.
Okay, it's a really good question. I personally think that the more data you can gather, the better. The more information you have, you should use. And because we know that risk is often misinterpreted or exaggerated in some cases in people's minds, that it's good to know exactly, what the past experience has been in certain areas. You see a kind of an access inertia in places like Afghanistan, where agencies are staying in areas perceived to be safer and reluctant to kind of test the waters in new areas. So I think the more information you can have, the better. But we've also argued that humanitarian actors and donors need to move from a mindset of risk transfer to risk sharing. And I'm not sure if that's completely appropriate to the question here, but what we see is donors tend to push the risk, real or perceived, onto NGOs, and the NGOs push it out to their local staff and local partners. And what needs to happen is a more clear and explicit acknowledgement about the risks that are involved, including both security risk and fiduciary risk, and a kind of a shared ownership of these risks by both donors and agencies, with the understanding that after all the mitigating and preventive measures have been taken, there will still be a residual risk that could be realized, and that both sides need to understand and accept. So I also think that in terms of data, studies like SAVE and information like OCHA is doing can press the issue. And I can talk more about that later, because I think I'm kind of heading off track.
No, that's perfectly on track. Thanks, Abby. And Sandeep, what are your thoughts on this question from MSF Spain?
I just give you an example of Afghanistan. Most of these agencies are present towards the northern side of Afghanistan, and there's limited presence in the southern side, where there is higher level of conflict. Some of the reasons could be is that like the north historically used to have a higher presence, more developed activities. It's also more prone to natural disasters. So there were DRR activities. The conflict has, although it was previously it was mostly concentrated towards the south, but now it's moving towards the north. And organizations have just adopted this coping strategy to limiting their presence to urban centers, scaling back their presence, although there is enough evidence that there is more humanitarian need in these harder to access areas or more conflict affected areas. Partners are basically lacking this incentive to move to these areas. So maybe donors could provide them this incentive, although there are risks in terms of programming. You might not get as much as return in the investment in hard to access areas than in easily accessible areas. It's more of a question of practical commitment than the data that's available. That's what I think.
Great, thanks, Sandy. Really, really interesting, talking about the incentives that need to be put in place there, and this idea of return on investment raises some really interesting questions that are being faced right now as we look at these significant and growing gaps in coverage. So a lot to think about. I want to pick on a question that we got from a number of participants and registrants before the webinar about tools and methods that they can use to map who is doing what. So the START network has asked, because they are interested in developing a methodology to map the presence of its 42 members. And others have been asking about online platforms or other tools that they could be using to map presence. So I'm wondering, Abby and Sandeep, what are your practical recommendations for, it sounds like mainly INGOs or INGO networks, that they can use to map presence in different countries, particularly countries that are highly insecure. So again, Abby, over to you first.
Okay, so we were really arguing that it needs to become an operational norm for organizations to have and to readily share this information within their coordination structures. So whether that's a smaller network like START or kind of the country level clusters. We do tend to think that it's better to do this as broadly and universally as possible, not really to fragment it within different structures and platforms. So the broader the better. But you can see that with just a few key data points, you'd be able to put together a pretty decent picture of humanitarian presence. So that is, every organization should be able to report at the national level and provincial level and district level for instance, the number and location of their offices, number and location of their staff, or if not the actual staff numbers, then the number of paid positions, because staff come and go, and that's very changeable. Also, the number and location of their activities, meaning the projects or components of programs that they're implementing, either directly or through their partners, and the number of total beneficiaries that they're serving, again, down to the district level. Now, if all of this information was available from the individual agency levels, which I don't think would be so onerous, then compiling it and reconciling it for the whole country to deal with this sort of double counting issue, things like that, really wouldn't be a huge methodological problem. The difficulty really comes in when someone has to go around, as our researchers did, and sort of manually extract the information from one organization at a time.
Great, thanks so much, Abby. And I have a follow-up question for you on that. But before we turn to that, Sandeep, any thoughts on tools and methods they can use? I mean, I know you've presented a number of tools that OCHA is using. Obviously, there's tools being used by the clusters and HCTs. So are you thinking that INGOs should really try to work with those tools and make them work for them? Or are there additional tools and approaches that you would recommend?
I think for a start, like there could be a basic data collection, something like if it's a consortium of NGOs, they could have a registration process with just some basic information. And all of these agencies do report to their donors, they report to their clusters. Maybe it might be a good idea to just get that data from those agencies rather than asking them to report all those activities again, like a duplication of reporting. Like NGOs are, they also have to report to the government. So there is an kind of an overload of reporting requirements. I think it might be a better idea if we just collect basic information, like what Abby mentioned, number of staff, district coverage, and get the detailed information on activities from other sources that they're already reporting on. reporting to.
Great, great. Fantastic. Thank you both. Abby, just picking up on this piece around having people actually on the ground to help collect this data, you mentioned in your presentation that you use field-based monitors to collect information on presence and staff in very hard to reach areas. I was wondering, is this an approach you would use again as a researcher or for humanitarian outcomes? And would you recommend this for people who are seeking to improve on-the-ground accuracy by partnering with local researchers?
Yeah, well, the answer is yes. When you're actually going out to create and build the new data sets, there's really no substitute for field level research if that's where the information is. And that really means having the time and the budget to make that possible. So we were lucky in our case that DFID saw the importance of this, and we got a generous kind of 6-month inception period followed by 2.5 years of a research phase. So that really enabled us to have teams working on the ground for several months at a stretch, which is what made it possible to do the heavy lifting of counting and verifying humanitarian presence data. Now, different countries will have different levels of capacity for local research, and it requires that you invest in scoping that out as part of the inception period of any study. There are, of course, good ones and bad ones, and you need to look at track records and references and beware of some local research outfits which have been accused of falsifying findings in the past. But in general, it's the best investment you can make.
Great, thanks so much, Abby. Sandeep, we also had a question around updating this data over time. So there's a question that came in around systematically collecting and updating evidence on presence in a constantly changing humanitarian context over time. So this is increasingly what we recognize as our humanitarian reality. How does OCHA try to stay updated on your understanding of presence as it shifts and changes over time?
So these two tools, the natural disaster tracking and the internal displacement tracking system, they are basically live. Like we get the data every day. We still have a very simple data collection process, but there is minimal time in processing. So the data is almost live. It tells us about where the new displacements are taking place, what are their needs, what response is being provided. That's the first step. And I mentioned earlier that the Humanitarian Access Working Group is working on a more systematic approach to collecting information related to access and coverage. We're not quite there yet, but this year it will be our focus.
Great. And Sandeep, if I could ask you to just elaborate a little bit on that in terms of how often do you think this data needs to be updated? I mean, how quickly do you feel it changes? You've been in Afghanistan for 3 years. Um, how much does the presence of humanitarian actors and their activities in particular areas of Afghanistan stay the same or change over time? Does it need to be updated every month, every other month, or is it more of an annual process that you think would be suitable?
No, it changes all the time. So one day an area can be accessible. Next day there is a major security incident or an attack, and there's no access to the area. So it's a very volatile situation here. This data should be updated as often as possible. So we should have a mechanism to actually monitor the situation as it happens.
Great, and we'll be looking to OCHA to have that on a dashboard pretty soon. That sounds really handy. Um, Good, so moving on to a few questions about best practices that we've been receiving. So we had a question around the best practices of identifying and working with hidden actors in emergencies. And this picks up on a theme that both of you have talked about, which is on anonymity. And this is a key feature of the operating environments of many of these insecure settings, and one of the issues that really prevents a clear and accurate picture of who's doing what and where. So we've had a few questions around anonymity. One question is, how can we get over anonymity to identify good local partners? Another person has asked about the connection between anonymity and corruption risk. So the fact that organizations are operating anonymously presents certain risks around corruption. How do we know organizations are behaving appropriately if these operations are being kept secret? And finally, a question around coordination. So how can we strengthen coordination within hostile environments, particularly subnational coordination, which ALNAP's research on coordination has highlighted as being a major area where we need to have improvements and we need different approaches. How do we strengthen coordination at the subnational level when humanitarian actors are operating anonymously? So those are three different issues, but all connected to the overarching challenge of anonymity. And to answer this, Sandeep, we're going to go back to you first, followed by Abby.
For for Afghanistan, although there's some of these actors do not want to be publicly mentioned in public reports or papers, they are involved in the coordination structure. So they are not quite hidden actors. So even in the field level, they regularly attend the coordination meetings and they raise a coordination system at the national level. So I don't think the actual we have these really hidden actors in Afghanistan.
Okay, great. Thank you. And over to you, Abby. What are your thoughts on the challenge of anonymity and addressing these three issues?
Yeah, I was going to make the exact same point that when you get down to the local level, the aid actors know who each other are. So anonymity really only extends so far, and there is coordination that's happening. If the question is more about how to identify the good local actors to work with, or to find new ones, we did talk about kind of looking beyond the traditional humanitarian actors when it was necessary. To see what other sorts of actors and mechanisms might be able to get access, for instance, local commercial actors, if that's necessary. But where they are present, the local organizations, it's, I think, less about finding the good ones among them than it is about creating good partnerships. So my colleague Catherine Haber's research component on this, on maintaining access and quality, found that better access can be achieved when the international actors take the time to assess the partnership, so the institutional and operational capacities of the partnership rather than just the partner, and strengthen the areas that are important to the success of the partnership. So this will also, it will involve each partner complementing the capacities and compensating for the weaknesses of the other partner. And it really does go both ways. And this is maybe slightly off topic, but I just really wanted to get a word in about the National Red Cross and Red Crescent societies, which usually have very good access relative to other humanitarian actors, but don't tend to be utilized as operational partners very much by the international agencies, apart from their cooperation with the ICRC and IFRC. Now, I know that sometimes they're seen as partial or potentially too close to the government, but in areas where needs are high and access for humanitarians is severely constrained, I think the international aid community needs to ask themselves if the outcome of no aid is better than aid that could go in that might be problematic in some way. So I just wanted to make that point.
Great, thanks, Abby. I think that's a really important point, in terms of the mechanism versus the end, and how humanitarian actors choose to work and how they choose to deliver, and whether or not those it's in a sense flipping the principled question on its head, right? Because it's the sense in which being principled can actually shut us off to opportunities to enhance humanitarian presence, as opposed to pushing us to expand those areas of presence. So I think it's a really interesting and important point. We have a question, actually, Abby, that's come in over the chat, and I'd like to encourage everyone else who's with us to continue asking questions, any points of clarification that they might have. on either presentations. Abby, the question for you is, can you elaborate more on complex and simple programming? Is there a rule of thumb used in determining which one to apply given a particular situation or context?
No, I don't think there's any rule of thumb, and I don't think there's really any blueprint for organizations doing this. I think it happens kind of organically, where in a less insecure place, organizations will be doing programming at a different level. The longer that you're there, for instance, the more technically complex you can get, and the more freedom you have to move staff around from other parts of the country or international staff that would have the technical skill sets one needs for doing that kind of programming. So it's just something that happens. It tends not to be optimal, and we did see results in the affected population surveys that said that a large portion of the aid they received did not meet the most urgent needs. And in Syria in particular, people saying that really they'd had enough of the hygiene packets and food packets, and wouldn't it be great if there was more cash so that we could actually buy precisely what we needed instead of just receiving these kind of packets over and over.
Great, thanks so much, Abby. And kind of picking up on this issue, it's a point of clarification. We've been throwing these terms around quite a bit, presence and coverage, but Sandeep, there's been a clarification question for you based on your presentation. You mentioned that in OCHA you use the term presence rather than coverage because the latter is limiting. There's no question of what did you mean by that? So where do you see the gaps coming in between presence and coverage? And how does your mapping of activities and monitoring of activities help you understand coverage instead of presence? So if you could kind of elaborate on your earlier comment in your presentation on what you mean about the difference between presence and coverage, and that you find coverage to be a bit limiting.
Presence is just whether a partner has some kind of programming in the district. It does not say anything about the scale of the program. They may just be visiting the district once a month and just doing an assessment, so that's still presence. But coverage would mean the extent of, it could be geographical coverage over the district rather than the organization being present just in the district administrative center. Coverage could also mean the number of beneficiaries that they are assessing. So that's how I wanted to differentiate presence and coverage.
Great, thanks so much. We have another question that came in before the webinar from CARE, one question from an M&E advisor at CARE and a participant from NATO, each asking a similar question but about a different actor. So CARE has asked, what role can governments play in crisis-affected countries in the accurate mapping of humanitarian actors and in monitoring quality? And a participant from NATO asked, how can the military contribute to defining who is doing what in a crisis or conflict area? So we've kind of been talking about OCHA-led processes, INGO-led processes, and perhaps humanitarian research-led processes to map presence. But what kinds of roles can governments and militaries play in helping us understand the presence of humanitarian assistance and humanitarian actors? So Abby, if you could comment on that first, what you saw in your research across these 4 different countries, and then we'll move to Sandeep.
Yeah, well, to be honest, in the 4 conflict-affected countries that we were dealing with, we actually thought less about the role of host governments, some of which didn't really have the capacity to keep up-to-date registries of NGOs, and some of which you wouldn't necessarily want to know the operational details of what agencies are doing. We focused more on the role of donor governments in terms of us being surprised that they hadn't been more insistent on getting what seems like pretty basic data from the HCTs and their grantees in the field on presence and coverage. We know that donors can encourage and promote coordination and underpin it with their funding decisions it kind of all depends on how high a priority they place on it. But in terms of host governments, yeah, it was not a big part of what we were looking at.
Okay, great. Thanks so much. And Sandeep, your thoughts on this from the Afghanistan perspective?
Like we are always looking for more accurate geographical data or satellite imagery that militaries and governments would have access to. So that would, in Afghanistan, like we don't have any sub-district boundaries, so accurately mapping humanitarian presence, like we can say this organization is in a district, we can go down to whether it's in just the district headquarters or in the surrounding areas, but we can't really point out where they are working in the district. So accurate geographic data is like that would really help us. And in Afghanistan, the government is not that involved in mapping who's doing what or more on humanitarian presence, but sometimes, like in Pakistan, you need a permit from the government to carry out humanitarian activities. So that can actually be a hindrance than actually helping the mapping humanitarian presence. So
Could I just ask you to clarify that last point, Sandeep, in terms of, people being asked to register to carry out humanitarian activities by the government? Would that not, in some sense, help kind of at least the mapping of humanitarian presence? Maybe it inhibits the presence itself, I suppose, but does it not help centralize the information on who is doing what and where?
but the governments also sometimes do not want to share this information, so that's another hindrance. And this registration process often takes a lot of time. Like even to visit some areas, you need a permit from the government. That can be more of a hindrance than it's a benefit.
Great, thank you. Abby, we have another question that's come in here that we think will give you an opportunity to geek out, which is totally what we want to do on this webinar, since we're talking about evidence and the use of evidence in research. So there's a question of if you could briefly explain, because we've talked about the method that you used and the unique features of the different components that you pulled together. Could you briefly explain how you decided on this mixed method approach? I think in many cases in humanitarian research, one has a question where one could do really interesting creative things with the method, but there's always this matter of deciding what pieces to bring together and what to do and what to leave out. So if you could maybe talk about the background or the process on how you put together this mixed method approach and decided on the different components, and what kinds of criteria perhaps did you prioritize in your methodological decisions?
Sure. I think because we've been dealing with humanitarian operational security data for so long and dealing with the problem of getting rates, right? So you need the aid worker population in order to get rates, so you can really see whether violence is getting worse or better in different areas, et cetera. And it was always a major stumbling block that we didn't have good population data. So when this project came together, we kind of wanted to start from there and look at what presence and coverage actually look like in the field, just because it wasn't there. It's something that is there to be known, and we should know it. So I think the data was kind of central and primary to what we were doing. And data is just going and counting things. So that's what we decided to do. Now, the other things that we were trying, the regressions, et cetera, kind of came later. When once you have the data sets, you can decide what it is that's interesting to look at, what stories the data can possibly tell. But we would never do that without contextualizing it with the actual qualitative information that's coming from the people who are on the ground and experienced, and that's where kind of widespread interviewing comes in. And the effective population surveying is still fairly new and something that we've been experimenting with in in a couple of different projects, including State of the System. And, not to plug it again, it's something that really we think should be brought more into research on humanitarian assistance, because the voice of the actual end user, the consumer, has not been well heard, and you find some really interesting things. And just to maybe make a point of one thing that surprised me when we looked at the affected population survey data is that when people were asked what their most urgent needs were in these protracted conflict settings, they tended to be protection in the case of South Sudan, or food in the case of most of the others, as the number one need. But the number two, or at least in the top three needs of every single one of them after that, was education for children. And I had been one of these people that had usually dismissed the education and emergencies cluster and things as, well, that's not life-saving, et cetera. But the salience with which people hold education for kids, even in very dire crises and conflicts, was I think striking, and it's something that it's worthwhile bringing these things out. So I don't know if that really answers the question, but I think our tools are limited in research. But like we were talking about before, we all need to get more empirical and more evidence-driven in what we do.
Great, and just a quick follow-up on that, because you mentioned one of the pieces that you did this for earlier on was one of the previous iterations of the State of the System report, and now more people are using these techniques. Do you worry about survey fatigue with affected populations as a result of that?
Well, the sample sizes for an overall population are not huge. I wouldn't worry about it, given the polling and surveys that we get in my country, the United States, and around the world. It's still very limited what's going on in the field, and it's interesting that respondents are often given an incentive for participating. So you probably have less of a worry of survey fatigue if someone's getting sort of 50 cents for answering a survey. I think it's a good means.
Great, thanks so much for that. So I think we've reached our last question here, and it's a question about impact. And actually, I'll ask Sandeep this question first, and then we'll end with you, Abby. So someone has asked us, how does an accurate overview of presence affect impact? And I kind of take this to be this big so what question. We've been talking a lot about presence and understanding who is doing what where. How is getting better data and better analysis of presence going to help us achieve better impact with humanitarian assistance? How do you connect the dots in that theory of change for yourselves? So Sandeep, if you could take that question first, and then we'll give the final remarks to you, Abby.
A more accurate overview of presence and the needs would highlight gaps in presence or gaps in coverage, but for the impact, it's still up to the agencies that are working. They have to have the incentive to go to areas of greater needs. It's more of an operational issue than the data issue, I think, because although this the information of presence and gaps might not be centralized and accessible to everyone at the field level, everybody knows where the needs are, so it's really more of an operational issue than a data issue. That's what I think.
Interesting. Controversial, but interesting, Sandeep. Always like that. Good. So very thought-provoking. And Abby, your thoughts on the presence and impact question?
Yeah, well, it's such a good question, because you're right. And so what? So this is really more than just an issue of knowing what the aid worker population is area by area. And I agree with Sandeep that what it does is give a clearer picture, or a picture that people really hadn't been seeing, of the gaps and just how small the humanitarian presence really is relative to the needs in many of these emergencies. And this can help, I think, become the humanitarian efforts become less supply driven when you're really seeing the sort of drop in the ocean that some of the response is relative to the need. But also, it's essential to good preparedness to have a known inventory of capacities and sort of troop strength, if you will. So before the next escalation of the conflict or new natural disaster that occurs in these places, to have this information at the ready will improve the response and I think have better outcomes and impact.
Great. Ending with preparedness, always a good topic, another topic that we don't look at enough in this sector. So it just leaves it to me to thank our two fantastic speakers today. We are putting up some additional links for people to follow up on, and we will be sending the audio or links to the audio and the slides in a couple of weeks' time. So thank you very much to everyone who sent in questions ahead of time and who participated today. And thank you again to Abby and to Sandeep for a really good discussion on presence and how we can understand it better. Thank you and have a wonderful afternoon.